My name is Tim Reha, host of Digital Health Live at the International CES 2015 in Las Vegas. Our special guest today is Dr. Phil. You might recognize, hey, how are you doing?
I'm doing well. I'm excited to be here. This is my first time at CES. I guess I've come to the biggest one, huh?
Yeah, it's expanded. In fact, the event here today grew so much we had to move it to a whole new pavilion. We have 800 people. So what was it? So basically what we're doing is interviews and catching you off stage and kind of catching the hot points. What did you bring to show everybody today?
Well, I think the thing we were talking about today, when we were talking about Doctor on Demand, which is a new app that I've had the privilege of co-founding with my son Jay. He's kind of the brains of the outfit. But it's a new app that we're kind of in our 53rd week of at this point that has just gone wild. And it's an app where you can download it onto your smartphone, and with the click of a button, within an average wait time of about 2 minutes, you can be face-to-face with a board-certified physician that treats anywhere from, well, actually, we treat 17 of the top 20 reasons people go see doctors. I mean, whether it's urinary tract infections, flu, things that you just normally go see urgent care for, your family practitioner for, that type thing. And we're very excited now because we have just added mental health services to that. Yeah, we're very excited about that.
So walk me through the mental health experience, and how does the mobility and connecting people remotely change the game?
Well, we do think that it is a game changer, because one of the biggest obstacles you have in a therapeutic relationship, because unlike an urgent care type thing for a physician, it's an ongoing relationship. And as a practitioner myself, I was in private practice for 12 years, the hardest thing you had was continuity, because people's lives, I mean, first off, sometimes they just go into avoidance mode, and it's easy to come up with an excuse. I don't want to talk about what we're going to talk about next week. So, my car broke down, I can't get there. Or legitimate reasons, they're out of town for work, or their child is sick, or they just simply have to work or can't get there. This allows a chance for them to maintain the continuity of that therapeutic relationship. And I mean, let's face it, you spend more time getting to the care that you need and back than you do getting the care you need. And oftentimes you spend more money in terms of arranging for a babysitter, driving, parking, all that, than you spend on the care that you're actually getting. So this eliminates all of that. And you're able to, instead of just clicking on and being in front of a doctor, you're able to go through, select a therapist, schedule an appointment, and then see that person on an ongoing basis. And you can do it from the anonymity of your own home.
Yeah, what's really interesting is I've got like the new Samsung Note 4, and these are full HD video telepresence conferencing. Sorry, these are basically full video telepresence conferencing systems with sensors built into them, and then we have new mobile sensors that can pick up all kinds of devices. So that's completely game changing.
You know, it is. And if you were thinking about just talking to somebody over a speakerphone or something like that, as a therapist, you would lose a lot of information that would be germane to making clinical judgments. So many cues are nonverbal. Maybe their ears are turning red, or they're not wanting to make eye contact, or they're starting to sweat, or whatever. But if you've got them on a high resolution monitor where you can see them as well as I can see you right now, you don't sacrifice those visual cues. That's very important.
So I bonked my head on the way in, and I would actually be able to go in and do images. And then what's on the doctor side? What are they seeing?
Well, on the doctor side, and of course, lighting is important. You always want to have your patient well lit. But when you're dealing on the medical side, you're able to take a picture and instantly send it to the doctor. Maybe it's a picture of your throat, if you think you've got ulcers on your throat. If you think maybe you've got pink eye or something, you can show the doctor just over the screen as you're talking to him or her, or you can take a picture of it that the doctor can manipulate and zoom into. If you're in talking therapy on the mental health side, maybe you have some email exchanges that you and your significant other have been through and have been arguing about. Maybe you opened your child's sock drawer and you said, wow, is this marijuana? Is this something this child shouldn't have? So you take a picture of that, you upload it to the therapist, you're able to talk about that. So you're able to do everything in a virtual session that you would do in an actual session.
It sounds like you can also streamline the point of care to develop a system that can take information from here, and then if I do need to come in, I've already have that information pushed to the doctor?
Look, you're always going to have some type of storage of information. If you're seeing a therapist, they're probably going to scan your documents and hand them back to you. And they're not going to keep your originals. They're going to scan them and store them digitally. They're doing the same thing here. So you really sacrifice little, if anything, by doing it in this way. And you eliminate drive time. You eliminate all the expense of going there. And the costs are about half of what you're going to spend if you're seeing that person in person.
So let's drill into costs. I'm an entrepreneur, I'm a startup, so I self-insure and have a little policies. Do I have to have insurance? Do I have to pay for the app? How does it work?
You download the app for free, and if you're seeing a doctor, a medical doctor, the cost is $40 for a 15-minute visit. That's equal to about a copay.
And I heard the average doctor visit's 7 minutes only, so this is like almost double the amount of time.
It's almost double that. The wait time, the average wait time for seeing a physician is 20 days. On Doctor on Demand, it's about 2 minutes. And the cost is about what you would spend on copay or less. So it's just very, very cost effective and so much less stress on you in getting the care that you need.
So it's on Apple, Android?
Apple and Android. You can go to Google Plays or you can go to the App Store on Apple. So it's easy to find.
Now, what about the mental health side? One last question and we'll wrap there. How are you changing the game?
Well, the thing here is I can tell you from being in practice for 12 years, if someone is sitting at home and they say, I'm experiencing anxiety or depression or just problems in living, they say, I need to find a therapist. Where do you go? You open the yellow pages, you don't know one from another. Somebody says they're a therapist or a doctor, or you really don't know quality or fit wise. Well, we've done that homework for them. We have a bio of that doctor, what they specialize in, what their licensure is. We go through that so you can compare and say, this feels like a good fit for me or this one does. So it's not a yellow pages sort of thing. You've got information there on this person, and you can do a session with them. If it doesn't feel like a good fit, then you can try something different. And we have so many physicians and on the mental health side therapists. You have a broad selection to choose from. So we've done the homework for them. We make it easy, and it gives them opportunity to do this without fear of judgment and without disrupting their life by having to take off work and do the things they have to do to get there.
Okay, cool. So what types of people are you trying to connect with here at CES? There's a lot of innovation, and how do they connect with you guys?
Well, it's so interesting to watch a tech-savvy group that looks at this. They're going, well, yeah, this makes total sense to them. It's like, wish we had thought of this and done it. And I think that it's just a confluence of myself, who has spent so much time in the healthcare delivery system, and my son Jay, who is very tech savvy, and it was just kind of a father-son kind of came together, and so I think it makes a lot of sense to people.
All right, so check out the app. You can search the web and hit #feelgood on the Twitter hashtag. Dr. Phil, thanks for your time. Thanks, Jill Gilbert and the team here at CEA for producing the biggest event in the world for innovation and to showcase new technology.
Well, Tim, thank you. You guys have put on a quality show here. Appreciate it.
Cheers.